Wardrobe sponsored by Charmaine Freeman Designs.
Hi, good evening. Welcome to the Sharmark Show. I am your host, Sharmark Leon. Thank you for joining me this evening. Those of you viewing in St. Lucia, Dominica, Antigua, thank you for joining me. This evening we have Miss Joseph here. We're going to be talking a little bit on oral health, which is very important. I mean, I to have a white smile. Dental health is very important. Very, very important in our daily lifestyle. Good evening, Miss Joseph.
Hi, Sharmark.
How are you?
I'm fine, and you?
Yes. Tell us a little bit about who's Miss Joseph.
Okay, I'm Maxcelia Joseph, and I'm from the community of Monrepo, but I reside in the U.S. It's been a few years since I've left St. Lucia, but this is my homeland, so I'll never forget this place.
Okay, nice.
I'm here with our beautiful Sharmark. I'll be talking a little bit on oral hygiene today, the importance of oral hygiene, and also, I'll be touching a few points on teeth whitening, which I see a lot of individuals in St. Lucia, based on my social media content. They're interested in doing whitening. And there's a few things I think that they could improve on in getting better results.
Yeah.
So I'll also be sharing a few points and also try reaching out to quite a few individuals, as many people, who's listening, also people could share the word on how we should take our oral health more seriously.
Yeah. Are you nervous, Miss Joseph?
A little bit.
Just relax, relax. This is
I'll
the
be
Sharmark
okay.
Show. We just kick in and it's a vibe. I can tell in your tone of your
Yes.
voice. So tell us, when it comes to oral hygiene, in terms of a basic thing as brushing your teeth, what is the guideline, the proper way a human being should brush their teeth?
Okay, so first off, I would touch on saying we should use soft toothbrushes to
Okay.
brush our teeth. And to brush, the first thing you should do is to rinse with some water, floss, then brush.
Okay.
There are techniques in brushing that most people are not aware of, which we should brush in like a 360 form. So majority of our individuals, they brush going up and down. But we should use our toothbrush the same way a spin brush spins.
Spins like this.
Yes,
Yeah, that's what
if
I
you're
do,
not using a
yes.
spin brush and you're just using a regular toothbrush, you should also brush in a 360 form. So you go from 360 one angle backwards, 360 going all around. You do it for the lingual part, which is the inner part of the teeth, and the outer part.
Okay.
Okay, so that's the buccal side of your teeth, which I'm
Okay,
just trying to
nice.
explain. I'll
Yeah.
make it more in simpler terms. And you will go ahead and brush your tongue afterwards. The last thing you do, rinse. You rinse a second time, then you use your mouth rinse with your Listerine. And that's a proper way to brush your teeth.
Okay, nice.
One important thing as well that I think we should focus on, how regular we should change our toothbrushes. That's one routine that we should keep in mind. Every 3 months, an individual should get a new toothbrush.
Okay. Nice.
I will stress on this. We don't use medium, but we use a soft toothbrush.
Okay. And
Okay.
funny enough, a lot of persons think the harder the bristle, the cleaner
No.
the teeth, but that's not what it works.
That's not what it is.
That's not how it is.
So the harder you brush is the more damage that you're causing to your gum and your tooth enamel.
Oh, wow.
So I'm a hygienist. I'm not a dentist. I could talk on a few things, but there are
Okay.
things that I have knowledge of. I have information I could share, but I won't share because I'm not a dentist, but I'm an oral hygienist.
Thank you
So
for that, yeah.
I will let you know that brushing with hard toothbrushes could, one, cause gum recession. So gum recession is when you see this gap between your gum and the apex of your tooth. So you could see the root of your tooth
So
exposed.
it's almost like when your teeth is protruding out of your gums.
Exactly. That is recession, and then it causes sensitivity.
Oh.
So you may not have a cavity, but because of that gap, this barrier is supposed to keep your teeth warm and away from like air exposure, okay? When that is exposed, it causes sensitivity. So brushing with a hard toothbrush could cause that. Brushing with a hard toothbrush could cause abfraction. It could eventually wear down the enamel of the tooth a little bit.
Oh, wow.
Abfraction is when you get hairline fractures.
Okay.
So that's a bit too abrasive for the tooth enamel.
Okay.
Okay.
For those persons who can say, "Oh, swear I'm a brush dumb way tonight. Me, I just go into bed. You have finished, have a mac and cheese, a chicken, and all of that, and you just go to bed and you do brush your teeth." How dangerous it is in the long run if you don't brush your teeth at night?
Okay, so brushing at night is one of the most critical parts of keeping a good oral hygiene practice. So if you brush, for example, you had a meal and you go to bed, all the bits, food particles would stay between the interproximal of your teeth. That's between the spaces of your teeth, and that goes under the gum line. You get up in the morning and you brush. As this dissolves, it gets into the gum.
Okay.
Whatever that's exposed comes off. Whatever that got dissolved, it goes in. Yeah.
From what you're saying, basically, it sounds like the gum is a very sensitive
Yes.
part
to
of
food
our
debris.
teeth.
Yes.
Wow.
And eventually, this could cause what we call gingival issues. So then you
Okay.
start having gum disease and bad breath.
Okay.
It start causing cavities. So you
Wow.
could start losing your teeth eventually. You may need root canals, start having cavities. It's all because of that bacteria keep building up and building up and building up, and then start creating issues.
So normally, I think most persons with to have a cavity or situation with the oral to go to a dentist. How often it is to just go and do a cleaning or just a checkup without having a cavity?
A dental checkup should be done every 6 months. It could be done every 3 months, but it's based on how your insurances work or an individual's will to pay for that, or if there's a need for it.
Okay.
If someone does not have any gum disease or they have no other issues like other bacteria building in their mouth for other reasons, so they could go to the dentist every 6 months for cleaning.
Okay. But you say if someone doesn't have, but the question is, most times people look okay, but however the issue is there.
How would you know that?
How would you know
if
that?
you go to the dentist.
Okay.
So if you make going to the dentist a habit, okay, then you would know what your needs are. So the dentist will go ahead and do x-rays for you and an examination. Those x-rays would tell if you have any caries, okay, if there's any work needed. And the exam, the doctor could do this thing they call probing. They use this to measure the pockets of the gum.
Okay.
Okay, and then we could tell through the depth of that whether if someone has gum disease or not.
Okay.
Okay. Someone has gum disease, what they will need like an SRP. That's how we started. That's the early stages.
Okay.
It could progress where you will need to see a periodontist.
Okay.
That's when it has become severe, and the doctor now, an SRP will not help, but the periodontist needs to go and do some treatment for you.
Okay.
All
Wow.
right.
So with gum disease, this can be a scenario, a situation where you can lose a lot of your teeth.
Yeah, it could cause you to lose your teeth because now your gum is not healthy enough to support the teeth.
So
that
the
you
gum
have.
disease, sometimes you see some persons and the gums look like it's inflamed, it's very red. What's causing that?
That's gum disease. That's inflammation of the gum. When it looks red, the gum is inflamed. That means
Okay.
there's bacteria living in that area. One factor is it could be internal, right? That's causing this, and it could be poor oral hygiene habits.
Nice.
That's causing you to get that inflammation.
Wow.
Yes.
We'll be back in a bit with Ms. Joseph. We're talking about dental health, oral health this evening. So you need to call somebody. It's very important, and pay attention. Grab a pen, grab a paper to get some pointers because it's important. We want to keep this white smile. We'll be right back. Welcome back. This evening we have Ms. Joseph here with us, and we're talking about oral health, dental health, which is very important because we want to keep those white smiles. Ms. Joseph, tell us, sometimes you have individuals where the breath is not too, it's not attractive, but however the person's teeth looks white, they brush their teeth very often, and you might ask, why does that person have an odor? What can cause that?
Okay, so there could be two reasons why. It could be because of poor oral hygiene. Not because someone's teeth looks white, that they have good oral hygiene techniques at home.
Okay.
They're not flossing, but their teeth looks white. There's still food debris,
Okay.
calculus that's building up
Nice.
in there. That could cause them to have bad breath.
Wow,
Okay?
yeah.
Someone not brushing their tongue while brushing their teeth is an issue
Yes.
as well.
Wow.
It could be something internal, like they may be having some other health issue that's causing them to have this bad breath.
Wow.
So I would not just, for an individual to know if their bad breath is coming from, it's oral and not internal, they need to see the dentist. They may not be aware of the scent. I mean, if you're a good friend, you could let the individual know, pull them aside if you're comfortable enough to let them know that, something is going on. I'm a bit concerned.
Yes, yes.
And you
yes.
should also talk to them about going to see the dentist.
Yes, yes.
That should be the first step.
Yeah.
And then if there's no issue there's no reason why you should be having this bad breath. The doctor checked you, did your x-ray, did your exam, and you only just need a regular cleaning. You need to go and see your general practitioner.
Now we have so many companies, so many floss on the stick and the roll. Some of them look wider, some look like a twine.
Yes.
Which one is the best floss, and what is the best technique to floss?
Okay, so the best floss I would say is the wax floss. We like it. It has this stretch to it.
Okay.
And we feel like it does a better job when it comes into
Because it
getting
can
debris
roll
out of
over
the
your
teeth.
finger.
Exactly.
Okay.
Flossing technique, index finger if you're a right-hander.
Okay.
Left hand, your thumb and your index finger. So you pull, you wrap, pull. Excess floss goes between your thumb and your index finger.
Okay.
You have the floss wrapped around your index finger and your right hand if you're a right-hander. You floss, you pull, you push up and you pull, wrap around your index finger. You pull the floss from this hand.
Okay.
Okay.
Nice. So how do you control to
So
avoid
to control it, to avoid it
juking your
from,
gums?
so you push it up. You will feel when it touches the gum.
Okay.
You don't go further. You don't just go pushing it up. You will push it up when you feel like you're touching your gum.
Okay.
You pull out.
Pull out. Okay.
Wrap. You pull out by wrapping it around
So
your
you
finger.
just slightly, gently left
Exactly.
and right to go in the corners.
Yes.
Okay,
I should floss
nicely.
to show you.
Yeah. No, that's okay.
So you could
yeah.
wrap around the index finger if you're a right-hander, and you hold the excess floss between your thumb and your index finger on your left hand. So you push up, you floss,
Nice.
pull out, and you wrap. And you
Okay.
continue this way.
So tell us, which one of the floss would you not recommend?
So the floss on the stick, I would not recommend this.
Why
Most
is
people
that?
use it for comfort because it's easy to just hold the stick and push the floss
And
up.
some people have it stuck in the whole day, like it's
Exactly.
a raise.
It's bad. Most people, when they push this up, they push up their gum. And it causes irritation.
Wow.
And that inflames the gum.
Okay.
So we would recommend that you not use it. I mean, it is good floss,
Yes,
okay?
yes.
Someone who has braces, they could use this floss, but not just the floss part, the pick bottom of it.
Okay.
To pick stuff out of their braces, their
Braces,
brackets
yes,
of the
yeah.
braces. An individual, if you have good control when it comes to flossing, you could use it,
Okay.
okay? But you use it very gently.
Nicely.
So I'm
yes.
not saying you do not have to use it. You can use it, but you should have proper practice in using
Yeah.
it.
How dangerous it is that if you don't take care of your oral care, how can it affect the balance of your organs?
Okay, so basically not brushing your teeth will not affect you that much. It will affect you in terms of having bad breath and building up cavities and stuff. But if you, for example, have an infection,
Okay.
that's where the problem starts.
Okay.
It could cause brain fog, fatigue, loss of appetite,
Oh.
and stuff like this. So if you're not having any like severe issues, you don't have an infection of that, so your oral health will not affect your body.
Okay. Yeah.
But if you're having an issue like you have gum disease, where bacteria is building up, right? All that stuff that's in your mouth, your saliva, goes into your body. If you have an
Nice.
infection that is not taken care of, then it causes issues.
Okay. So my next question, nous parler pas toi.
Oui,
Okay.
yes.
So nous ka aimer ça pour ces gros moun là. Bonsoir mamie, bonsoir papi.
Bonsoir.
L'ani moun ki ka servi fodan, anglais nous ka kriye dentures. Dis-nous qui manière yon ni pour point ke dentures là. Si yon ni pour mettre tromper tous les soins, si yon sa dormi puis manger, quitter sa bouche, qui manière yon ni pour point ke dentures là pour pas faire bouche senti on y envier l'odeur.
Nous parlons, c'est Guamona dormi avec dentures là en dit de bouche yo.
OK, c'est bon.
Ça c'est pas a bon practice.
Uh-huh.
Tous les oswè le moun ay dormi, yo ni pou tiye dentures la bouche yo, ek mette dentures la trempé.
Là dans soulagement
La
dentiste
nan
ça ka ba yo pa.
soulagement ko yo ni an ti tablet, yo ka mette call a denture cleaner.
Ça ka fait rete fouet.
Oui, ou ka mette ya di dan ti pot la, ou ka mette tak glo di den, ou ka wese dentures la avan, ek ou ka mette dentures la a di dan glo a. La, ou nyon manye nou sa gade kot dentures, nous savons quitter là où aller si moun ça aller dentiste là. Nous avons une solution nous ka servir di dentist office là pour nettoyer dentures là by ces patients là.
Okay.
Si on passe à faire ça, nous avons une tablette nous ka créer denture cleaner, nous ka point nous ka tromper ka deep clean ces
So,
dentures
you can
là.
take tout tâche là, tout main here,
Tâche là,
fait like
tout
us a still
manger
put
dedans.
to toothbrush like
Oui.
chiwe.
A lot bagay, ou ni pou be careful, ou pas sa servi regular toothbrush ou les dentures. La ni
Ah.
soft denture toothbrushes. Ou ka servi sa pou nettoyer dentures là. Si ou servi or regular toothbrush, toothbrush la trop abrasive, trop weird, it
Ah,
can wear down the les dentures
Just
là.
dentures là.
Eventually, dentures la pa kay ask for, isa kasi.
So, let's say les moun sa leve le bon matin, you ni pou wense bouche yo,
Oui.
gums yo, kod yo ka di anglais, avant yo mette dentures sa via
Avant,
bouche
yo
yo.
mette dentures la via bouche yo, ni pou nettoyer bouche yo, ou wese bouche yo bien, ek den ou nettoyer lang yo.
Ah.
Ek den ou ka mette dentures la an da bouche yo. Because dentures se bagay, i ka build a shy bacteria.
Ek ki bien sensible.
I bien sensible, sou pa gade kont li bien. Koule a ka chanje, bacteria ka build up, ek sa pa bon pou bouche yo.
Ouais.
So, ou ni pou make sure that ou ka wese bouche yo bien, même si ou pa ni dan, ou ka serve Listerine, ou ka bien wese bouche yo, ou ka nettoyer zansiv ou.
Sensible. So, ça mette servi un rag.
Exactly.
Ek pase, ek nettoyer
Nettoyer
sensible.
sensive ou, nettoyer lang ou bien, wese bouche yo, bien wese dentures ou, ek mette bouche yo. But pa mette dentures da trompe, ek just tiye de glow ak mette bouche yo.
On
Ou ka
pou
point
essaye.
tak hand soap, ebe dishwashing liquid. Ou pa ka servi toothpaste, sa trop abrasive.
Ah,
Le
to
dentures la,
Ah.
oui. Ek ou ka wese ek la men, ebe soft toothbrush lo ka chiwe, wese ek den mette an di da bouche yo.
Ok, wow, merci. Ça, puis, ti pa to a sorti longtemps, pas parler,
Thank
ti
you.
pa to a merci. C'est
Oui, oui.
sou comprendre ça. So, actuellement, nous allons aller commercial, nous allons retourner tout à l'heure. Et puis, moi, Joseph. Welcome back. We have Ms. Joseph here, and remember, we're talking about oral health, dental care, which is very important to us as human beings. We want to keep those smiles. Ms. Joseph, tell us what's trending now in the modern world. Everybody is doing that teeth whitening, and there's so many different chemicals. What is the right routine to whiten your teeth, or what can you tell us, advise us in terms of if we want to whiten our teeth? Because what I've learned in the past that I think your teeth color matches your complexion. Sometimes it's so white, it's almost like you put actually bleach on it or acid to get it white, and I find it just looks so fake and it doesn't complement your skin tone. Tell us a little more about the teeth whitening.
Also, teeth whitening, I think, is an amazing thing to do. Teeth whitening, it builds confidence.
Yes.
You have a bright smile, you feel good. Okay, so doing it the right way, that's what matters.
Okay.
So majority of our people just would go to the pharmacy or go to some teeth whitening technician and get their teeth whitened. But the proper way to do it is to get a dental cleaning first.
Okay.
If you do not clean your teeth and you just whiten your teeth, it traps in bacteria. Okay?
So it's a process.
It's a process, yes. It traps in bacteria. The teeth, it would whiten, but it would not be whitened on an even note. So wherever stains are, would not be white.
Okay.
So it would be whitened, but it would not be even. Another thing, it also traps the stains on the teeth. So when you go for whitening, you know this rubber cup that they use to polish your teeth after the whitening?
Yes.
Your cleaning, sorry. This takes stains off the teeth.
Okay.
Okay. Also, if someone does teeth whitening, someone has had their cleaning done within a 6-month or 3-month period, okay, they're eligible to get whitening done.
Nice.
If you are certified to do that step, there's something that we use this in the office. There's also a paste that whitening technicians could use if they're allowed to use it, what we call pumice, where you could use on the surface of the teeth to take out stains before you do the whitening.
Okay, nice.
But the major factor is ensuring that a cleaning is done within a 3 to 6 month period before you go ahead
Okay.
and get the whitening
So if
done.
somebody's looking and then they can't afford a clean whitening, which it might be 200 to 300 EC about there, and then what can you get over the counter at the pharmacy, your hometown pharmacy? What can you get?
I would
in the
recommend whitening strips.
whitening strips.
Go
Okay.
to. Easy to use.
Is there a particular brand?
Crest.
Oh, nice.
Just through testing, that's the one I feel that has done the best. We have the most effective results and longer lasting results.
Okay.
But those results also would be based on your lifestyle.
Okay.
So lifestyle, I mean in terms of your eating habits.
Okay.
So if you used to drinking a lot of coffee, you drink a lot of dark liquor, you have a lot of like colored fruits like strawberries, grapes and stuff like this could cause you to start getting staining again. So
Okay.
what I would recommend, if you a heavy tea drinker, you're a heavy coffee drinker, you're a heavy dark liquor drinker, and you into teeth whitening for maintenance, you have alcohol, you rinse with some fresh water afterwards.
Okay.
Yes.
Nice.
There's also a time frame, a period after you get whitening because your enamel has pores. When the because we use peroxide is what actually whitens the teeth.
Okay.
So when the peroxide gets in, it gets onto the teeth enamel, it opens up the pores
So
of
you
the
have
enamel.
to. So you have to let
Yes.
it cure.
It absorbs that,
Okay.
right? Within a 24 to 48 hours, the pores are still sensitive, they're still open.
Okay.
They're still absorbing whatever that comes to it.
Okay.
So you need to refrain from colored foods within that time.
Nice. Wow, that's interesting.
So that's a very critical part.
Yeah.
That 24 to 48 hour period is a very critical part after whitening is done to maintain it.
Now, funny thing you're talking about after whitening, what is the period or the grace period after you eat? Because I understood after you just had your dinner, you should not go and brush your teeth right away. You have to give, there's a gap after you eat. What
There's
is
no
the
gap.
There's no gap.
You eat and you're ready to go to bed, or you
Just
you
right
heading
away
out,
you can go ahead
You go
and-
ahead and you floss. Always make
Okay.
sure flossing is important.
Yes.
You don't floss after you brush.
Okay.
You rinse, you floss, and then you brush. You brush your teeth after a meal. It's okay.
It's
There's no
okay.
time.
Okay,
There's
no
no
time
time
frame.
frame after eating a meal to brush your teeth.
Nice.
Yeah.
Now, when you're speaking about kids, how important it is as a toddler in terms of oral health? What are the techniques to avoid a child from having early cavities,
So
especially those that suck in finger?
Okay, I would say it's just as important as an adult
Okay.
having to brush their teeth, because this is when kids are just starting, to get their adult teeth coming in.
Okay.
So we know kids have their baby teeth, what we would say, call them baby teeth. Those are, they lose those teeth, right? And their adult teeth is about to be exposed. That's a very critical part in ensuring that those kids keep brushing their teeth, rinsing, you keep them away from too many sweets.
Yeah.
So
Now-
high sugar content foods, you should try to minimize that.
They have some persons, they figure because he's a child, the child don't have to brush their teeth as often as an adult. Is that true?
It is as important as an adult for a kid to brush their teeth.
Okay,
Yes.
nice. Is there any techniques for persons that are bedridden in terms of brushing the teeth? Because you're lying all day, you eating that soft soup, that porridge and stuff like that. If the person is somebody who keeps their mouth closed most of the time, maybe a child that has a seizure, maybe the kids that have cerebral palsy,
Yeah.
or whatever they're suffering with, mental illness or whatever, and sometimes they keep their mouths so tight. What are the techniques you think if they don't want to, you can have access to the toothbrush that you can do to get to clean that mouth?
So I love this question. That's a very important point that you just came up with. What we would do for patients like this, because most people with disabilities, they have a hard time with allowing people to get into their mouth. Okay, having a toothbrush is an important factor. If you're able to use a toothbrush for that individual, we'll tell you go ahead, brush their teeth, and you could rinse their mouth. Get maybe a wet cloth that's clean enough that you could use to rinse the mouth out if you're not able to use water in their mouth. Okay.
But you have those persons that are like really bedridden, they cannot come up to spit after you brush
Those
their
are the
teeth.
individuals that we use sterile gauze. There is a 4x4 gauze. It's wide
Please
enough.
explain, ma'am, what is the what's it?
It's a sterile gauze. It's
Okay.
a 4x4 gauze that we use, like most surgical doctors use that.
Okay.
We would wet it, soak it up nicely, and rinse. That's how we would rinse their mouth out. Clean their
Okay.
tongue out, pass it around their teeth, just soak it up in some clean water.
Okay,
And
nice.
that would help them rinse their mouth out, because you don't need a whole lot of water to rinse your mouth.
Okay.
So just having that soaked up in some water, because you know it's sterile, it's clean enough,
Yeah.
and you could use that to just go after brushing their teeth. You could just use this to take the excess.
We're about to wrap up,
toothpaste
but
and
I'm
stuff
going to
out.
put up one more question before we wrap up. In case a lot of persons sometimes say the Listerine is a bit too strong, the alcohol in there, is it wise that you can dilute it with water?
It's good. Diluting your Listerine is perfectly fine.
Okay.
It's not an issue, because not everybody. So if one thing, you should know if you're sensitive to the alcohol in the mouth rinse that you're using. Because
Okay.
Listerine is just the brand, which we have. That's one
Yeah.
important thing that a lot of people are not aware of.
Yeah.
Listerine is just the brand.
Listerine
but
is
it's
the
a
brand,
mouth,
yes.
overall, it's a mouth
Oh,
rinse.
mouth rinse, yes, yeah.
So
Thanks for
most
that.
people are sensitive to the alcohol that's in the mouth rinse, because it's
okay.
like little bruises in the mouth, or they
yes.
get very sensitive after they use it.
So it almost goes back. That's why you have to use a soft toothbrush,
Exactly.
don't you? Don't
Yes.
create those scars and stuff like that, blisters in your...
Exactly.
Okay.
So we'll go ahead. You buy mouth rinses that has no alcohol in there, alcohol-free mouth rinses.
Okay.
Or you could go ahead and dilute it. So you put maybe 3 pumps of the mouth rinse, add some water to it, and then you could rinse. So it will not be as aggressive to your mouth. It will not be
Okay.
so sensitive towards
Wonderful.
it. That's all.
So, Ms. Joseph, before we wrap up, is there anything you would like to tell us before we wrap up?
So basically what I would like to say is, most people, whoever is listening to this show right now, I'd like you to take this advice. Don't wait when you're having dental issues to see the dentist. Make it a habit.
Yes.
Go to the dentist.
Make it a
There are
lifestyle.
several dentists around. Make an appointment. We buy tickets to go to parties. We get our hair done, our nails done. We go to the doctor for all other issues. Our oral health is as important as our overall health.
Yeah.
So make it a habit to see the dentist with or without pain.
Yeah.
And continue with your routine, your 6 or 3 month cleaning, and just make it a part of your lifestyle.
Yeah. Ms. Joseph, I would like to take this opportunity to say thank you for the education this evening. It means a lot. I got a few pointers for myself. But solutions, before we go, just remember, if you can't afford the private dentists, right now the government had make it easy so you can use the polyclinics. They have dentists. So find out the polyclinic closer to you, what days the dentist is available, and then it's important. We're servicing our vehicles, all kind of things. So it's important that we maintain our oral health, clean, just keep it tidy and just make it happen, Thank you so much, Ms. Joseph.
It was a pleasure.
It's a pleasure.
Sharmark,
Thank you
yeah,
so
thank
much.
you.
I'm Sharmark Leon. Thank you for viewing. Have a good evening.
Wardrobe sponsored by Charmaine Freeman Designs.